You can change the way you perceive things. So you can dampen pain signals. It may still suffer, but you can lessen its blow. You can take agency over what happened and try to make it more palatable. If you lost your leg, you lost your leg. It's not going to grow back. You can still smile in the day. You can still watch that sunset. Well, you still may suffer, but you bring meaning to life because life is more than just the meat bag that you occupy.
Dr. Jordan Barber is a clinician, educator, author, and published researcher known for explaining Chinese medicine without mysticism or oversimplification. Chinese medicine, most chronic disease comes from the mind.
People don't like to hear that. However, Chinese medicine gives you agency. It makes you responsible. We say the heart is the emperor. If the emperor is content and happy, everything is ruled with regularity and everything is good. If the emperor is agitated, he's going to do crazy things. He's going to yell, he's going to scream, he's going to behead people, whatever. Your chi becomes deranged in the land. If you keep a peaceful mind and you keep a joyous heart, you should not have all the diseases of stress. If you don't enjoy your life, you have this negative belief system where you are constantly secretly wishing that bad things are happening.
His published research includes studies on the efficacy of acupuncture and dry needling in the Journal of Medical Acupuncture. He is a former faculty member in bioscience and acupuncture and serves on the NCC AOM-AI Task Force. He is also the author of Realigning Medicine, a guide for healthcare practitioners building sustainable, value-driven practices. Please join me in welcoming Dr. Jordan Barber to the show. Hi, everyone. It's Dr. Taz. Before we get into today's episode, I just want to pause and say thank you. Your messages, your shares, your stories are the reason we make Whole Plus. Every conversation here is about connecting the science, the intuition, and everyday life together so you can feel more like yourself again. If you haven't already, hit that subscribe or follow button. It helps us reach more people who need this. All right, let's begin. All right, Dr. Jordan, I'm super excited to have you here because Chinese medicine is a huge part of my personal healing journey, and it's actually a significant part of our practices at Whole Plus. We actually bring some meridian evaluation, Chinese medicine evaluation into what we do to help us sort of understand what's going on with the patient, and we have acupuncturist on the team, herbalist, all the things. So huge fan of the field. You know, it is, I always preface so many things and say it's my favorite system of medicine out of all of the ones that I've studied. So I'm excited to have you here because you live, breathe Chinese medicine day in and day out. Talk to us a little bit about what attracted you to Chinese medicine and how your practice has developed in the years since.
So I'm excited to talk about this, and obviously it is my life, like you said.
Yeah.
So I could talk forever. You know, if you ever seen the movie Office Space?
Yes.
I feel like that's my life, right? I started in IT.
IT?
Yeah, IT.
Okay.
Networking.
All right.
Always was a weird kid. So, you know, I had, I guess, predilections to herbal medicine and everything else. I had some stomach issues when I was like 15, and I remember taking some Ayurvedic herbs. And I went through 9/11. You know, I was there.
You were here in the city.
I was there at the Trade Center.
Oh,
So,
wow.
you know, and I was 21.
Okay.
I was already dealing with health issues, but at that point I was like, I don't know if corporatism is where I want to be. I like computers, I like systems and networks, which if you read my book, you'll kind of understand that Chinese medicine is all about these interrelationships.
Yeah.
It is kind of networks. So, you know, I had all the standard stuff, surgeries, all the strange things to try to make myself feel better. I was still suffering. Looking back, I was burning the candle at both ends. I was living off food carts down in Phi Dai, was doing everything wrong. But within 1 month of trying acupuncture, which is strange, I woke up in a dream with the word acupuncture. I was like, I know that exists, but is that real? And this was like 2002.
Yeah.
So I'm like, I don't even know how to find it. Are these people licensed? I went, but within 1 month, I was about 80% better.
Wow.
The 20% after that was a long journey.
Yeah.
But I was like,
better?
okay.
What specifically got better
So
for
I
you?
had a lot of like reoccurring sinus issues
Okay.
that just would not go away. And when you're constantly sick, your life is drained from you. You know, I had sinus surgeries, you know, I did all the things. Nothing worked. But change of diet, I stayed away from dairy for a while, took some herbs and had acupuncture, obviously. And within a month, I was able to live, right? Which for a 21-year-old, 22-year-old, that's all I was looking to do. You know, meanwhile, dealing with where do I want to be? How can I actually have a life worth living? Because
Yeah.
9/11 kind of made me have a perspective of saying, if I just died in that building today, serving, for lack of a better term, corporate masters, I don't know if that's the life I wanted.
Yeah.
So, I went to Chinese medicine and realized there was no industry.
Right.
And that was the worst financial decision for the longest time.
Right.
But it all turned out to be fine.
So so our timing is similar by a few years. So I was going through my health crisis. I was like 25, 26 at the time. By 28, I was done with the conventional. 28, 29, I was sort of like, had exhausted all the medical options. I'd been to a ton of doctors over the course of 18 months trying to find answers, and had gone to this weekend conference in holistic medicine, which opened me up to Chinese medicine, right? Like I didn't even know it existed, right? Going through regular medical school. And so I sought out, Chinese medicine practitioners, and, their whole way of interpreting and talking about me in that particular instance was just so different, from all the experiences I had had and all my training. And it was like, I just, I tell the story often and I'll tell it again, but like, this older Chinese medicine practitioner, glasses, the whole thing, is like waving his finger at me, and he's like, bad chi, very bad chi. I'm like, wait, what does that mean? What does that mean? I have bad chi.
Mm-hmm.
Well, again, they really put me on the path of healing. I started acupuncture. I got better. Again, health is an unfolding journey. I learned more about myself over the years and started to turn things around. But their system of thinking and the way they thought about things was unlike anything else. Ayurveda might come close, but was unlike anything that I had really, studied or looked at. And, I realized there's a place for it in the medical model, and there's an important place for it because it does connect the dots between systems and emotions and organs and tissues and all these different things. And so, I set about looking for how to train and what to do. So I ended up going out west and learning acupuncture there and some herbal medicine, but didn't go to the extent that you did where you're like a doctor of Oriental medicine. Can you explain the different credentialing of Chinese medicine practitioners? Because I think that's important because you have acupuncturists, herbalists, and then you have doctors of Oriental medicine.
So the first caveat I would give is we're a young field.
Yeah.
So it's a little all over the place. But
interesting.
You're I don't want to say basic. Basic is not the right word, but the entry-level practitioners, the standard acupuncturists, depending on states, that may mean that they also studied herbal medicine or they just specialize in acupuncture. And that's your licensed acupuncturist. That's generally the term that's used in most states.
Right.
Then you have professional doctorates, which a lot of people do, and that's like an expert generalist. So that's just going a little beyond studying and just kind of having... The focus really is more understanding Western medicine even more. We have to study Western medicine and Eastern medicine because we exist in the 21st century.
Right.
But that's more of systems-based medicine, understanding how to really integrate with the standard medicine. And then there's the DAOM, which is a 2 or 3 year, depending how quickly you want to do it, kind of expert in field with research literacy. And that's kind of what I did, which means glutton for punishment.
Right.
There's no, you don't get paid more. There's
Yeah.
nothing special.
Yeah.
And for me, my focus was on pain and something called psychosocial medicine or psychosocial phenomena.
Gotcha.
Which we could talk about, but it's really just a fancy word of talking about Chinese medicine.
Gotcha.
So that's kind of what the field looks like now. As far as herbalists, some states require you to be an herbalist to practice. Some states, they weren't really that interested in herbal medicine. So they said, here's acupuncture. And, if you want to do herbs, maybe that's okay.
Yeah.
There are certifications at different levels, and that's done by the National Coalition of Chinese Medicine. I think they recently changed their name to NCCAOM. There's a new one, I think NC NICBOM. I'm not really sure. But that's where you can find those people. They do the diplomat status.
Gotcha.
But that's not always required in every state. So that's what I mean. It's very messy across the board because we're a young profession. And it does create some kind of, I guess, quality control issues. But we are kind of at a new resurgence. We are really starting to get it together as a profession, even though we are shrinking in schools.
Oh, really?
But the ones that will survive are the ones that are really creating quality practitioners. So we're in a change. But yeah, there's a lot of schools that have been closing.
Interesting.
Sadly.
Why do you think they're closing?
A lot of them were kind of private schools, right? And they had a lust for Chinese medicine, but not the desire to deal with Title IX, Title IV, and all these other things and all the systems that were required. And it gets more and more complex and exhausting. And then with the future proposed changes in student loans, it kind of shrinks that availability to finance the whole thing.
Got it.
So Chinese medicine right now, along with many other professions, isn't necessarily listed on the list of graduate allotments of the amount of money that you can have with the proposed changes in the master's degree programs.
Got it.
So it's a mess. But I stay away from all of that.
From all of that.
I used to be very involved.
Right.
And I just want to treat the people.
Well, for a consumer who's interested in Chinese medicine, right, or even acupuncture, is there something they should be looking for?
So as long as the person is licensed, that means they have passed the exam and the state has qualified them to be competent in what they do. So that's your basis. And then like every other doctor or practitioner you want to work with, you need to have a conversation with them. Have you treated this? How do you treat this? Are you familiar with this? Because just because you're licensed, and we know this with medical doctors or anyone, doesn't mean you're conversant in it, doesn't mean you're very good at it. And that's not a slight. You might be good at the thing you're good at. But, like we were talking before we started, gynecology isn't my main area, even though my main area is pelvic floor. You would think they're related. I can talk about gynecology, and I know my way around it, but you don't want to come to me for that because it's not what I do.
Issues.
So you want to talk to me about that. I actually had a discovery call just recently, and it was not really pelvic floor, but it was stuff down there. And I was like, no, you need someone that does that. I don't treat that. A practitioner knows to stay in their lane is the good practitioner.
So let's talk a little bit about Chinese medicine in particular as a field and as a system of medicine. Now, before we, the Westerners, got our hands in it, right, it was handed down generationally in terms of formulas and in terms of practices and things like that. I had a guest on, you may know her, Janelle Kim, who came on, and she had been handed down formulas, over generations of different things that work. And that was the old way of doing things, right? Now that we've brought it in kind of into modern day timing or so, help us, how would you explain, I have my definition for it. How would you explain Chinese medicine in the simplest of terms?
Ooh, in the simplest of terms. There's so much I want to say about that history and how that went down.
We can
that
talk
for
about
second.
that. Yeah.
Chinese medicine in the simplest terms is actually a way of thinking. And that's kind of where the title of my book comes from. Because it's a way that you perceive information. All the modalities, acupuncture, qigong, herbs, whatever, it doesn't really matter because those are the things that you do to the body after you understand what's happening. So it's a way of thinking and seeing. That's what Chinese medicine is. And even more so, I think the easiest way to wrap your head around it is what's uniquely specific about Chinese medicine and Eastern medicine for the most part as a whole is that Eastern medicine has a definition of health, what an ideal, perfect, healthy person is. Any aberration away from there is disease. You don't have to have an actual category of disease or a laboratory finding that's enough to meet a criteria of something. We examine you. We see what's going on, how different systems are working, how you're eating, pooping, breathing, sleeping. And we start seeing, oh, this is how you're away from that idealized model that no one will ever achieve. The closer we get you back to that, disease will disappear. Whereas standard medicine has categories of disease, and until you fall into it, I don't know, you have a syndrome, I don't know, you don't feel well, good luck. And that's why it doesn't do as well at chronic care. Where Chinese medicine, we excel at chronic care.
I want to pause here because I see this pattern all the time. People are doing the research, they're listening to the podcast, they're trying to take better care of themselves, and they still feel so stuck, especially when it comes to their health, their hormones, their stress, and even taking care of their families. That's why I created The Circle. The Circle is my private membership where we go deeper into these topics with real guidance, demos, live sessions, and a supportive community. If you want to try it, there's a 1-month trial available right now. You can learn more at wholeplus.co/circle. That's HOLPLUS.co/circle, or just click the link in the description below and use the code YouTube. Now let's continue the conversation. They focus on that, right? The other way I've always thought about Chinese medicine, or the way I've tried to explain it to patients, is that it's an energetic system as well, right? They believe in energy, they believe in the flow of energy, and then they will tie together the physical, the mental, the emotional, the spiritual, all of that kind of comes together, in Chinese medicine. Is that a good explanation of it?
you're asking a person who has nitpicked that so much. Yes, to a point, because, we've heard the term spiritual bypassing before, right? If we solely just think it's only about energy, which there is an energetic component, then we are prone to just saying it's your energy only and you just got to fix your energy. And Chinese medicine has never seen that and never spoke that way. That's actually how it made its way to the West through certain things. And I could go into that. But it's Chinese medicine's very practical. They understood that if a muscle was tight, you put a needle in it and it twitched and released, you were better. There was no energy there.
Right.
We could say the qi was blocked, but what's that mean?
Right.
Well, the qi in medicine is really metabolism. So that local metabolism was often such a way that the muscle was in spasm. By inserting a needle, there was an axon reflex and it released. There's no magic there. And even so, the Hongdae Neijing, Yellow Emperor's Classic, which was 3,000 years, Han Dynasty text, that book was a movement away from spiritualism and shamanism.
Oh, really?
When you go through, it's like there are no demons, there are no ghosts, blah, blah. They're not saying they don't exist, but it was a real kind of like nature and observable signs and symptoms was the core of things. If we did this thing, it would occur, and it's reproducible medicine. Now, Chinese medicine is so rich enough in its observational manners that there is room for energy and the unsaid and the things that we have not yet defined in medicine. Maybe you could say quantum medicine, but I don't know anything about that. So there is an energetic component because there is an explanation of things that we don't have a way to explain in modern science right now. But not everything is energy.
Right.
And I think that's where we go wrong, where we're like, oh, it's all about moving the qi. Sometimes it's, very simple.
Very simple.
For example, large intestine 4, we all know that. Hagu, and it's one of the things all over TikTok. Rub that, it cures practically everything. Well, because of the plexus below there, it stimulates the paraductal gray, right? So we've established that on fMRIs, which means it modulates pain throughout the entire body. Okay, we could say we're regulating the qi there, but there's also a very substantial thing that's happening there. But that's the beauty. There's not separate medicine. There's medicine that works, and there's medicine that doesn't work. So just because it's alternative to what? Medicine that works? That doesn't make sense to me. It's a logical fallacy.
So it really shouldn't be outside the medical model. And we shouldn't think that Chinese medicine is woo-woo.
No, and that's what I mean about, there is an energetic component, 100%.
Yeah.
But
there's a lot of science in Chinese medicine.
There's so much science. And it's validated in such a way, like through fMRIs, to just reproducible
fMRIs, guys, functional MRIs.
Right. So we can see exactly what's happening in real time, what parts of the brain are lighting up, so to speak, or EEGs, etc. So I think it is medicine. It is just like other medicines. There's a time and place for everything. If you were just in a car accident, please don't come to me.
Yeah.
Right? That's the worst medicine for it. Sure, we have a history of traumatology, but I really think Western medicine shines at that.
Does a little bit better at that, yeah.
But when you are suffering, you want to have multiple lenses to be able to see what's going on. And Chinese medicine is a great lens. And we have tons of lenses within Chinese medicine. And I think it's a great complementary modality to standard of care, but it's not alternative.
Yeah.
It's something that should be evaluated within it.
I'm right there with you, and that's what we do in our clinics. Actually, we use the diagnostic process to help identify, and then we'll use conventional labs and, technology or whatever else to prove, and so it's a methodology that we're able to reproduce over and over again, bringing the two together. And it's actually super fun and incredibly rewarding work at the same time,
Rewarding's that key because it's so validating.
Yeah.
And you actually say, if this is true, that means there's a lot of other things that are true. And that the world is a very integrative, cohesive model, not just medicine. And then what does that say about life in general? And that's the thing that gave me a passion when I was searching for something new, and I fell in love.
Yeah.
Because it was validating on so many levels. And every day in clinic, it's validating.
Well, let's go into the history a little bit, because I do find that I don't want to spend too much time there, but just maybe a quick blurb on the history of Chinese medicine. It's an old system of medicine, 5,000 years old is what we usually say. How did it get to the West? You talked about the Yellow Emperor's Classic. That's the textbook that people quote and cite and look at now. Maybe just give us a little sense of the evolution of it and its landing here.
Yeah, that's a core text, and there's many other texts, and it's a Han Dynasty text, 300-ish BC, before the Common Era. from there, each dynasty had a slight different focus or play or evolution. So I'll just fast forward through all that. However, with the Silk Road and everything else, there was interrelationships between Greco-Roman, scholars and medicine and theories and Ayurvedic. They all intermingled. So let's say that anything is pure. It's just Chinese medicine took its lens and adapted it, just like it does in modern science now. We fast forward, we get to the last dynasty, the Qing. And then from there, they were being exposed to the British, who were bringing modern early medicine. And they were trying to figure out what we call flavor in nature. How does this work within their theory, right? How does aspirin work? Why does it work within Chinese medicine theory? They were always evolving and growing, which was the beauty of it. But then we had the Cultural Revolution in China, which they stopped all Chinese medicine.
Right. What year is that?
The Cultural Revolution, well, it goes through... when you had the fall of the Qing, I want to say that's the 30s, and then the Cultural Revolution, I think the peak was in the 70s, but through there, everything was, passé, and I'm not an expert on those timelines.
Just rough,
But roughly.
Yeah.
But however, in the 80s and 90s, suddenly Chinese medicine was really important. You had the Barefoot Doctor movements and everything else. Even before then, but it started to really come together as TCM. Really, in the 70s, you started seeing TCM really come together. There's reasons why in China, and we'll bar all those political reasons. But suddenly they were like, oh, let's put this together. But now they rewrote it in a very simplified way, which is what we call TCM, traditional Chinese medicine, which is a way to teach people rapidly. Right, so you see bar charts that also look the same as grain production, right, that you would see during the communist era there. And you start creating people to treat people. They didn't have enough regular doctors. But then you have, in the 70s, there was a reporter from the New York Times that went over there with Nixon, had an appendectomy while having no anesthesia. He had acupuncture anesthesia or something like that.
Yeah.
So there was a great interest. And that's when it started coming here. But the problem was that was also the Transcendental movement. The Beatles were going to India. And we had no vocabulary in the West except the text that happened in the 30s and 40s by this Frenchman called Georges Soleil de Marant, who was a French bank clerk who had no understanding of Chinese medicine, but was eventually a diplomatic translator. He's the guy that gave us meridians and gave us energy because we had no words. Is it wrong? No. But is it accurate? It's myopic, right? So it suddenly constrained us to just an energetic medicine and then revalidated by this 1970s Transcendental movement.
Yeah.
So the West perceived it in a true Oriental sense, which is now a very passé word, but the word means to perceive the East from the West. And we were kind of now, how do we put this back together? And in the 2000s, there's a resurgence to the classics and starting to bring this, even in China, starting to kind of bring the medicine back to its wholeness again. But we're, like I said, a young profession because it almost disappeared. And a lot of the old doctors almost vanished.
Gone. Yeah.
Yeah. So some of us are lucky to have kind of passed down lineages. Like you said, it was handed down.
Right.
Those lineages still existed, but they went kind of underground for a certain moment or two. And then we had to repiece things together.
A lot of the herbal formulas are handed down concoctions, right?
So you have family variations, but you have the core texts, like Shanghanlun, et cetera, which are like these core treatises on how the medicine works. And they all kind of come from different lenses of how would you apply these different things. But then you have those ways that we changed it. But what's interesting, there were also regional changes.
Right.
Sichuan and the South is very different than the North because they treated different diseases. They also had access to different herbs. So there's so many variations. So sometimes they say these coveted formulas is like the formula. I'm like, yeah, if you were living in Sichuan. But in New York, that might not be the right herb for you.
That might be,
because it's super hot over there.
Yeah.
It is humid, but it's really hot.
So within your clinic, are you doing a lot of custom herbal formulations or custom formulations?
I do a lot of hands-on stuff and I do a medium amount of herbs, but I tend to do custom formulas.
Okay.
Partially it's the bias that's been passed by my teachers. I was lucky enough to be passed things, just as we've discussed.
Right.
Which does not make me good. It just means that someone explained things to me.
Yeah.
And I just really feel that customizing things is the best. Now, sometimes people fall into what we call patents, things that you just get right off the shelf. Take it. Sure, it's fine. As long as it matches you enough, I think it's fine, especially in maintenance.
Yeah.
But I really think custom formulas is the way to go. That's how it's always been done.
And the biggest complaint I get
Mm-hmm.
from patients is some of the custom formulas with the herbs and the teas and stuff like that. Like they get a brown bag, they don't know what's in the bag, right? And they're like, I can't do it. I can do it for X amount of time, but it's not something I can keep up with. What's
Yeah.
happening there?
Yeah. So good medicine is bitter.
Yeah.
That's the only way I could say
It's
it.
only good if it's super
No,
bitter.
I mean, GMP pharmacies will give you the list of the herbs and you should know, but you're going to be like, I don't know what this is. It
Yeah.
doesn't grow here.
Yeah.
So there's that one issue right off the bat. Luckily, we have progressed. So you can get granulars, which are kind of decocted and turned into instant tea, and that is a little more palatable sometimes.
Yeah.
You can also get those into a capsule, and the good GMP pharmacies will capsule your custom formula for a price.
Yeah.
And then you don't have to taste it at all. However, and there's arguments, I won't say what side of the fence I'm on there, that tasting it is part of it.
Right.
You know,
Part of the
not the
experience.
suffering
Yeah.
part of it,
Yeah.
but that flavor creates certain reflexes and creates certain changes in the body. You know, if you suck on a lemon, you immediately astringe, you pull in. It's
Yeah.
very astringent. So that action is an action on your chi, or the action on your metabolism to pull in. What is that neurological trigger in the body? If you don't get that, does it work? Maybe. Sometimes. I don't know. We don't have data, honestly.
Let's talk methodology for a second. So qi, shen, symptoms, diagnoses.
Yeah.
Break it all down for us.
Ooh, I would say read my book.
Break it all down in 2 seconds.
In 2 seconds.
Yeah, no, I'm
Okay,
kidding.
first the elephant in the
Yeah.
room. What is qi?
What is qi?
Qi is a descriptor. Qi by itself means nothing, right? Although we use it so much that we all kind of know what it means in the field. So it's the qi where, what is it? So in medicine, I like to say the easiest way to understand it from a Western view, in medicine, qi is metabolism, but in a larger sense, not like, you know, the Krebs cycle, right? But interrelationship between things in an area. Proper interrelationship, whether biomechanical or blood flow or neurological, hormonal, whatever, means it's functioning well. There's good qi. It's fine. If the area is messed up in some way, the qi is bad. And then we have poetic ways of describing how the qi went bad, so we know how to make it good again. Shen is what we talk about, spirit, right, or the mind or consciousness, and we tend to say across the board that everything starts with the mind.
Mm-hmm.
But if you fell off your horse or got hit by a cab, you know, that wasn't necessarily your mind, although one could argue maybe you weren't alert enough. There's room for interpretation, but we say most chronic disease comes from the mind.
Let's say that again. In Chinese medicine, most chronic disease comes from the mind.
People don't like to hear that. However, Chinese medicine gives you agency. It makes you responsible at the end of the day. Because if the mind and the spirit are not in harmony, and they both reside, what we say, in the heart. We say the heart is the emperor. If the emperor is content and happy, everything is ruled with regularity and everything is good. There's peace in the land. Your body is the land. If the emperor is agitated, he's going to do crazy things. He's going to yell, he's going to scream, he's going to behead people, whatever. Your chi becomes deranged in the land. If you keep a peaceful mind and you keep a joyous heart, you should not have all the diseases of stress. Right? We know what stress does to the body.
So they talked about that way back when.
100%. So we're talking about sympathetic lock. We're talking about all these other things. But also, do you enjoy your life? Because if you don't enjoy your life, you have this negative belief system where you are constantly secretly wishing that bad things are happening. That's the thought process, right? I'm really dumbing down thousands of years of philosophy.
Right.
So we do have that argument. And Dr. William Morris was one of my doctoral professors. He coined the term eco-psychosocial, and that's why we have psychosocial in my degree. Eco-psychosocial was the term that he coined to say, in a Western term, how we described Chinese medicine, because it was how you existed, where you existed, your interactions with people, and your internal state that dictated disease. That's the truth of Chinese medicine, and that's the beauty of Chinese medicine, and I say it gives you agency as a doctor. Whatever those titles mean. The doctor comes from Latin docere, right? Docere means to teach or to have knowledge of. I don't heal anyone. I don't have any magic, right? I can help you, I can guide you, but you have to take control over it. And Chinese medicine does that. You're going to come in, maybe put some needles some places, we do some other things, we give some herbs, but you also have to stop eating the cheeseburger 5 times a
Right.
week if the cheeseburger is your problem. You also have to go to sleep and not stare at the phone. You have to wake up with regularity. If you hate your mate or partner, you need to leave.
Right.
And if you hate your job, you need to change it.
Right.
Otherwise, Chinese medicine says you will continue to suffer in some way, shape, or form.
Mhm.
Now, that's not also saying we don't want to spiritually bypass that. You're the problem for your cancer. Right? Like, just because now you got happy your cancer is going to go away, I don't know. Right? And you have, Gerber Mate,
Yeah.
right?
Yeah.
Who does say that.
Yeah.
Maybe. Life's complex. So we don't want to just make everything so simple.
Right.
But that is the essence of Chinese medicine, is you have agency over your life.
I love that message, though.
I
It's an
think
empowerment
it's
message
beautiful.
versus something's wrong with you and we need to fix you.
You don't need to choose to suffer. You may suffer, but you could choose to be happy while you're suffering, which is a very weird statement. You can change the perception, and there's always a way that you can leverage your state or your mind. And there's plenty of cases throughout history of people that have suffered immeasurable things, but were still joyous, even under duress and pain.
So let's break that down for just a minute, because that's one that's hard for the Western mind to get around, right? You're in pain, you're hurting, you're suffering, yet you can be joyous.
Neuroplasticity.
Help us with that.
Yeah, neuroplasticity. You can change the way you perceive things. So you can dampen pain signals. You can change how or why you feel you're suffering. You may still suffer, but you can lessen its blow. And if you can find meaning or existence within that suffering, you can invert that. And we see that through the saints in all religions, of how many suffered but still served people and helped people. That's kind of that perspective there. Now, we're taking a very outside of the bell curve.
Right.
Generally, most people, look, there's terrible things that happen to people. And we don't want to devalue that when we
No.
say it. But you can take agency over what happened and try to find as many levers to pull to make it more palatable, right? If you lost your leg, you lost your leg. It's not going to grow back, right? But you can still smile in the day. You can still watch that sunset, right? You can create really great relationships with people. You still may suffer, but you bring meaning to life, because life is more than just the meat bag that you occupy.
What are some simple ways people can, you gave this analogy of pulling levers, right? What are just some simple things people can do to start to, they're in a tough place or a tough spot, they're suffering, right? Whether it's from a disease or a situation or whatever, financially, whatever it may be. What are some of the things that they can start to do?
So borrowing a full consult with a Chinese practitioner who can...
We're stealing your brain right now.
Right. Figure out, because it's not simple. And that's the problem. The medicine's simple, but the practice of the medicine is an art.
Yes.
Right. And so Dr. Peter Karen, who wrote the book with me, who's a phenomenal practitioner, we started using the word levers within our book.
I like that. Yeah.
Right. Because it's understanding the system as a whole and finding where that leverage is, because that's the art of Chinese medicine. Now, I would say you almost can do an examination of the mind, because if we're taking the premise that if you have a calmer heart and a different outlook, you'll start feeling better. You will be more parasympathetic. That's a fact. So you can start saying, what is your circadian rhythm like? Are you going to sleep at a regular time? Are you consuming media that makes you enraged? Are you worrying about things that you have no control over, taking like a stoic view of things, right? Those are simple things. But then we're talking about food and diet and everything else. Are you eating healthy? Now, Chinese medicine, thank God, does not really have a true, you must be vegan, you must be that. No, you must eat things that are good for you. If you notice the giant bag of gummy worms you eat every night, which might be me, is affecting your digestion, you need to cut down the gummy worms. You probably can still have them, but less. These are the levers over time. If you don't have positive interactions and relationships, create positive interactions and relationships, whether it's through therapy or socializing or getting on the internet and making friends. It's a modern world. These are simple levers. But to just say, I don't know, someone needs to fix me, that's the opposite of agency.
Interesting.
And that's what I don't do, and that's what no one in Chinese medicine does. Sometimes you come in and you get fixed, especially a stiff neck, very easy. I fix that. But the way you're lifting in the gym, you need to change that or it's going to come back. Or the way you sit at your desk,
It's such a like a paradigm shift almost
Yeah.
for how to think about yourself and your body,
Yeah.
health, healing, community, the
Mm.
situation you're in, so much more. And, I talk a lot about that in some of my books as well, about how these roads converge. Your physical
Mhm.
health converges with your emotional health and the decisions you make, and it works the other way as well. So I love Chinese medicine for really approaching things that way.
Mhm.
You've spent a lot of your career in pain
Mhm.
management, pelvic floor.
Mhm.
Can you talk about pain in general and what's happening there? We have a lot of people in chronic pain
Right.
of different intensities, right? There's low grade pain, neck hurts, back hurts, wrist hurts. I have rotator cuff.
Mhm.
I ruptured my Achilles at one time, better now, but at one point I was in pain.
Mhm.
What's happening in the pain pathways? How does Chinese medicine treat pain?
So Chinese medicine first treats pain the same way it treats everything. It looks at you as a whole. What's going on? Is this a biomechanical issue? Because if it's biomechanical, we fix the biomechanics. Pain goes away.
Right.
Is there some scar tissue? Maybe we break it up with needles. If it's a lifestyle issue and you're stressed all the time and you're stuck in a sympathetic state, and maybe now you're moving into maybe a form of central sensitization where the CNS is overactive now, and therefore normal sensory signals are amplified, so it feels like pain. Well, then we're going to work, which classification of points, if you remember, Huatou Jiaji points to paraspinal points. But these are spinal segments, which is where the information comes in, and we're going to change the reflexes there to downregulate that pain signal. If it's nerve entrapment, we're going to, again, look at the biomechanics, but also create maybe millimeters of space through different modalities, stretching, needling, et cetera, dry needling, et cetera. If it's an inflammatory process, we're going to look at why are you inflamed, right? So is that diet? Is it lifestyle? These are all the things that go into it. Now, for me, most of my people are biomechanical or neurological issues just because of the population. So I stay a lot more in that. Most people aren't systemically inflamed. They might have some inflammation,
Right.
but that's not the reason why they're in pain. It might be like one of the things in the bucket that was too much and sunk the bucket, so to speak. But it's not their main issue. Most of them are biomechanics, weekend warriors, post childbirth, things like that can create a lot of different issues. Spinal segmental dysfunction, having injuries, herniations, etc. That's the swath of what I see. So that's the stuff that I kind of work with mostly in my clinic. But it's not to say that when I notice that there's other things going on, that we say, hey, I do a lot of vagus nerve stimulation via the ear, actually. So using electroacupuncture. So the Stimulation of the ear, which is a piece of the ear has a bunch of different names, is solely innervated by the vagus nerve, the auricular branch. It's 100% innervated.
So we're seing a lot right now on social and everywhere about
Yeah.
vagus nerve stimulation.
But when you
and
look at the
people-
vagus nerve stimulation, where they're doing it, it's like parts of the ear and areas that might not even be fully
So
innervated.
what is vagus nerve stimulation?
So
Let's
the
just start
vagus
there.
nerve is really responsible for sympathetic, parasympathetic states. Stimulating that brings you into a parasympathetic rest and digest state. So and most of us will say that we are stuck in this fight or flight, position in our
Right.
lives. So by stimulating that, we can bring the body more into a lability between the two, because you don't want to be stuck solely parasympathetic either. You want
Right.
to be able to be up and down, right? You want to have action and rest. So it is really a biohack. But when you're stressed and you've maybe had tons of trauma or you're under so much pain, one of the things is to get the body into that restorative state is you have to bring it more closer to that parasympathetic state. So by doing stimulation, you could do it. I do it by the ear using electrostim, but there
So, like,
are
right
other
here?
ways. Yeah, so the
Okay.
Symbiconscious,
Yep.
right here,
Yep.
and, whether putting needles in there and attaching electrodes, or I'll take small TENS pads and just stick it there because I get a larger area and it works just as fine. And actually, there's very specific research that says 25 hertz millicurrent is like the tried and true stimulation. And you'll see all these very expensive machines, which I have bought all of them because I'm addicted to technology. And you look at their frequencies and you're like, there's not a lot of research behind it. What is it doing? Some of it's microcurrent. It is definitely stimulating it. But you want to just look at that clear research out there and get the best bang for your buck. So I'll use that a lot when I'm doing neuromodulation, which is electroacupuncture, to bring the body back to either neuromodulated, neurorehabilitated, and bring it back to a calmer state and start getting nerves to fire correctly, you can stimulate nerve growth factors and other things like that with different recruitment of receptors and everything else. It gets pretty technical, but electroacupuncture is phenomenal what you can do. So there's a whole neuroscience behind this. And notice I didn't talk about chi, but it's chi.
Yeah.
It's the interrelationship of what's going on there. Sure, you have stagnant chi. It's bad.
How many treatments usually, or how long does it take for someone to get better?
Depends on what they have going on.
Yeah.
Right. My tried and true, like my marketing is silly because I would literally say, if you're not seeing changes by the 4th or 6th session, I'm not going to get you anything by the 10th or 20th session.
That's a good framework.
Now, the reason why is I'm niched. I know exactly. If you're coming in for digestion issues, that's a whole different place.
Right.
But for shoulder pain or for pelvic floor dysfunction, there's only so much needling that's going to be done there, and those muscles are going to soften. And once they're softened, if you still have dysfunction, there's something else and I'm not the right person. Now I'm going to refer you. I work hand in hand with pelvic floor PTs. I think it's the gold standard.
Okay, let's talk about the pelvic floor, because we see so many men and women with different manifestations of pelvic floor dysfunction, right? It could be pelvic pain, it could be incontinence, it could be bladder spasms, it could be lower back pain, it could be the anteverted uterus, the retroverted uterus, having that pelvic tilt that's then causing hip dysfunction. I mean, I could go on, right? There's pelvic congestion syndrome, there's endometriosis, PCOS. So all of that to say, what's going on with the pelvic floor?
Right. So first we'll say 60, roughly, depending on studies, 60% of women will have some sort of pelvic floor dysfunction within their life. And depending on studies, up to 20% of men. But when you look for pelvic floor care, it's one of the places where men are just...
They're ignored.
There's nothing.
Yeah.
But men also have no clue what the pelvic floor is. Go ask any guy. I don't know what a pelvic floor is. I know what my pelvis is. So in pelvic floor dysfunction, the majority of the stuff that I have is pain. Pain anywhere's down there. I could start with some back pain, but it stems down to the perineum, or defecation-based pain, incomplete voiding, urgency of urine, right? Things like that. Stress incontinence, especially after birth. And then vulvodynia, painful insertion, painful sex, a lot of erectile dysfunction, which is like a huge thing for men's pelvic floor. Because when you actually understand what's going on there, it's wild, because we only use PDE5 inhibitors. That's the standard care. And it makes sense in a certain patient population, but a 25-year-old man that's suffering from ED, that makes no sense. I mean, it'll help, but like, it doesn't make that much sense.
Right.
So those are the things I really see. It's mostly pain. I tend to see hypertonic pelvic floor. When you're hypotonic, weakness, which is a more aged population, they need a different standard of care. So needling that pelvic floor and trying to soften it is the wrong thing to do. They need to be uptrained, and that's where PT's very good at. But a majority of the younger population is hypertonic, too tight.
Why are
compression
we so
on
tight?
the nerves.
Are we
I
sitting
have
too much?
ideas. I think partially sitting too much. We also like to be weekend warriors, especially the men. They go out, they do all these things, and then they go sit for 5 hours in front of a computer, 8 hours in front of a computer. Then they go deadlift 300 pounds. And then, and they don't even notice. They're like, oh, my butt hurts, but that was because I was just doing a squat. But it's like, it actually is radiating to the perineum, or there's pain after ejaculation. It's just like, oh, that's probably from the gym. No, that's an early sign, and it's going to get worse, right? Things like that. Women are so much more on top of it, but we have a big issue where urology and gynecology barely even understands pelvic floor therapy, physical therapy.
Right.
Luckily in New York City, we're like very on top of stuff, but even here, but you just go north of the city, there's no one. So pelvic floor care is so crucial, and you probably have pelvic floor dysfunction, you don't even know it.
What are signs of pelvic floor dysfunction?
I mean, the hidden signs is slight urinary leaking for men or women, right? Just after voiding, right? After urinating, just a little left there. I'm getting older. No, you have some pelvic floor dysfunction. That's okay, but you have some pelvic floor dysfunction. I said for men, weakness and erectile dysfunction. Pain after defecating, or pain around the tailbone. It's very common, coccydynia. Just little hints of that. And they're like, oh, it's really my hip, because it might also be stemming from the hip. Obturator internus, or numbness down there is a huge thing. Pudendal neuralgia, it could be numbness, or it could also be pain. And there's the pudendal nerve that runs through the obturator internus muscle, which is a hip muscle, gets compressed, and chaos ensues.
So hip pain could be pelvic floor dysfunction as well,
I
right?
say back pain can be.
Back pain.
At this point, the pelvic floor to me is like the entire body.
Wow.
Because the adductors, the ankle, your gait can throw off the pelvic floor. So most of the cases that come in, this is where I differ from pelvic floor PT, is I'm looking at those fascial lines. In Chinese medicine, it's called the jingjin or the sinew channels, but it's the fascial lines. I'm looking at the integration of the whole and seeing how that pelvis is functioning and moving, how tension plays throughout. It's like a game of Jenga, right? If one thing moves, for you to stay upright, something else has to move.
Yeah.
So if the adductor goes out, well, something else in the hip's going to go out.
Yeah.
If that happens long enough or you're under enough duress or strain, you're going to start getting dysfunction.
So will acupuncture help the tightened pelvic floor? What else from Chinese medicine helps the tightened pelvic
So
floor?
we specifically use a subset, which is called dry needling.
Okay.
And mostly because it's a non-retention art and it's immediately, it's very good at getting quick results and softening the muscle. You don't want to sit on a table with needles deep in your genitalia region for 40 minutes, listening to new age music. It's probably no one's idea of a good time.
Right.
We're talking in and out, get a release.
Got it.
So we
Okay.
do that. Herbs are useful when they're useful. So in urination issues sometimes. And then I do a lot of neuromodulation, especially in urinary voiding disorders, or just when there's kind of tension that just won't go away. I'll run small impulses through the pelvic floor, especially those like layer 3 deeper muscles, levator ani muscles, which are deep pelvic floor muscles. Sometimes it's hard to get even with the needle. We'll get close to it and then I will depolarize the entire region.
Wow.
Yeah.
Yeah. So I ruptured my Achilles, this Achilles in 22, the left, recovered, but then started to have some plantar fasciitis in the right, probably because my gait's
it's a gait and
off.
compensation.
And
But that
then-
had to translate through your pelvis.
Exactly. And
had
so
to.
then I know my right hip is now higher than my left hip, which is then started some lower back pain and left hip pain.
Yeah.
So then once I became aware, and then the other thing I noticed is I had this big anterior tilt, right? This huge
Lordosis,
sway in my like back because of all of this. So after I've been working a little bit more aggressively on lower core work and trying to strengthen and do all this other stuff, I can see it going away and the pain's going away too over time. I haven't yet done the acupuncture and the needling and all those different things. So
And general standard acupuncture is very good for more systemic,
right.
like interrelationships. For me, I tend to predominantly use dry needling because I just got too much to do.
Yeah.
So I'm working there, which is a subset of acupuncture.
Yeah.
So it's still acupuncture, but
Yeah, so interesting. So pain, pelvic floor, again, responsive to some of these modalities for sure. I don't know how much you work with herbs, but I get these questions all the time. What are your top 5 favorite, quote unquote, Chinese herbs?
see, I hate that question.
I know you do. That's why I asked it.
Because it's the wrong
So-
way
I
of
know,
using Chinese
I know,
medicine.
I know. But
Right?
that's a question
I love
people
herbs
ask
like
all the time.
gochita I love, but that's because I just want to eat it. It's tasty, right?
Yeah.
As a man, I like certain herbs for me because of my own problems, right? So I'm what we tend to be yang deficient. I'm 46. I'm getting older.
Yeah.
So I love lurong, which is deer antler velvet, right? Things like that. It tastes terrible.
Yeah.
But we know that it increases IGF-1, right? So it's a major stimulator. But I'm not going to tell people to take lurong if they don't need it. Why would you do that?
Right.
So I hate that. I mean, great digestive herbs are great digestive herbs, but even there, the people who need ginger are not the people who need mint.
Personalization.
It's personalization.
Yeah.
And that's why I hate the question. Not because it's a bad question,
Yeah.
but because anything I say would be the wrong thing.
Yeah. Well, this is a common question.
Yeah.
This is the way people think.
That's TikTok now.
Exactly.
Yeah.
It's the way people think about Chinese medicine. This is social media. This is TikTok. But speaking of which, Gen Z is dialing into Chinese medicine. What do you think is going on there?
So Gen Z is turning to integrative medicine and alternative medicine. But you have to look how they grew up. They're first fully online,
Right.
Generation. They grew up through financial issues, COVID. They've lost trust in any systems.
Right.
They also want personalization. The saying is that they want their medicine as personalized as their Spotify list,
Yeah.
right? They want it to know them. They want to be seen
Right.
and heard,
Right.
as all of us do. But like Gen Xers like myself or whatever are like, he's not paying attention to me. I don't care.
Right.
Whatever. Like, he's just a bad doctor. I don't
Right.
take it personal. They're
Right.
like, why are you not paying attention to me?
Right.
They're also dealing with new issues at a younger age.
Yes, for sure.
Stress and everything else and how that's affecting them. And they're very aware of it because they're fact checking everything because they have AI, they have
Because they can.
computers.
Yeah.
They can.
Yeah.
It's not a bad thing, right? It's just a new generation. So they're turning to it. And then, of course, influencers, which we love and hate, right? Social media has done wonders of exposing everything, but you can't go on a 45-minute discourse on herbs on TikTok. It's just
Right.
not going to happen. You're not
Right.
going to get the bites on that, right? But you can easily say, oh my God, ginger is phenomenal. I've been drinking this ginger tea and my digestion's great and I'm not bloated. The problem is everyone goes and drinks ginger, and those that have ulcers and hot issues, that's the worst herb for them. They need
Right.
it,
Right.
right? Or gua sha, which it's become an aesthetic thing, which is great. It's sure, it increases circulation. But gua sha used clinically, which is scraping modality, looks like you've been dragged down the road.
Right.
And you're not going to put that on TikTok. Although some people put it on there, but don't do that unless you
Right.
understand what's
Sure.
going on and how
Right.
your circulation is. And if you're on blood thinners, you go into the hospital.
Yeah.
So that's kind of like where we're at right now with Gen Z. They're
Right.
incredible. And they're such a smart generation, and they're turning to all this. But Western medicine isn't serving them.
Yeah.
Are we ready as integrative practitioners to serve them? We're trying, but there's a time and place that you need Western medicine.
What's your hope for Chinese medicine?
My hope for Chinese medicine is that we're taken more seriously, right? The practitioners are very serious people who are dedicated to this art. And if we can be part of that resource, right? The AMA talked about the physician-led model that they tried to push forward a while ago, that everyone's under the physician, which is fine. It's great. But we're nowheres in there. We're not part of systems-based medicine. We're outside of that bell curve. If we could just come closer to systems-based medicine, I think so many people can be helped. That's my hope, is to help more people.
I think my goal is to integrate the methodology and the philosophy into everything the doctors do and the way we see a patient. I think it would change so much. It would probably save healthcare costs, honestly,
It would.
because you are narrowing and you are honing in on what this particular person needs versus this whole group.
And that's
ahead.
the difference right now, though, is just that with healthcare costs is that insurances are looking at quarterly reports and the money they could save now and not the money they can save in 10 years. So integrative medicine, functional medicine is always at a loss there, even though we
Right.
know even they're cutting GLPs. And
Right.
regardless how you feel about them, we know that
They do something.
they do a lot
Yeah.
of things as far as long-term, especially in the patient population that needs them.
Right.
So cutting out diabetes, cutting out renal disease, lowering cardiac incidence is a
Right.
great thing,
It's huge. Yeah.
but they don't want to pay for that now. But
Yeah.
they'll pay for all that care later
Yeah.
because they're only looking at the quarterly report.
Right.
That's our problem right now.
Yeah, it really is a problem right
Yeah.
now. Well, you wrote a book.
I did.
Tell us about the book. What can we find in the book? What's going on in there?
So the book comes out May 19th, and I wrote it with Dr. Peter Karen. He's within my facility. He's a great person. We work side by side. We wanted a book to give to our patients. There was nothing out there, and we got tired of saying everything.
Yeah.
We also wanted the book to give to our students, because we were both former academics in teaching, to help connect the dots, because the students are too busy memorizing everything that they don't know how to connect the dots.
Yeah.
This isn't a book to explain all the nuances of Chinese medicine. There's a million books out there. This is written from the mind of the clinician of how we see. That's why it's called Thinking in Chinese Medicine. But it's accessible to anyone that's willing to engage with it. It's great for when we wanted to meet with medical doctors
Yeah.
and say, this is how we think.
Yeah.
There's no woo in here. We're not anti-woo by any means.
Right.
But it makes it simple so you can understand it, because it's a thought process. And what I didn't realize, Peter and I talked about after, is that it's so timely because it's the thing that AI can't replace.
Yeah.
AI can help understand a lot of things. It's a great tool. But the nuances that a human picks up, that's the uniqueness of Chinese medicine, but also the uniqueness of any good medical doctor. So at the end of the day, this is really a book about what good medicine should be. Like you were saying, of that integrative model and how to use it within a larger system to get better outcomes. That's what this book is.
It's been a game changer for me personally and for patients in our practices too. And I know that for sure. So I feel like it very much needs to be integrated. The philosophy needs to be taught. And then the integration needs to be taught too, how you kind of keep moving back and forth, between those worlds. And I think for the patients or for our viewers or listeners, what they need to understand is that Chinese medicine doesn't sit necessarily outside of the medical model. it can be a part of your overall medical package or medical team, and hopefully as we move forward in time and, can convince others of the same, it'll become the standard of care. It won't become outside of care. What's the state of research right now when it comes to Chinese medicine?
So I've published,
Okay.
and I have another paper coming out soon, hopefully, if it makes it a peer review.
Okay.
Not many of us are publishing.
Do
Um,
you think that would help?
I don't know, honestly, because a lot of the research, it's slowly changing, but a lot of research is, therefore Chinese medicine works, therefore acupuncture works. It's not mechanism-based. And what the world wants to understand is the mechanism, as far as the academic world. Why is it working? You have proved that if you do this, person has better sleep and they have increased REM state. But why? And there is some research out there, and that's what I'm starting to do. I have a paper on lower urinary tract syndrome that I'm hoping coming out there. It's purely mechanism-based, and actually doesn't even talk about Chinese medicine, but it's solely Chinese medicine because it's understanding what's going on, stimulus and ways of accessing the body in a cohesive model. We're missing that right now because as practitioners, we're not trained to do research.
Right.
We're clinicians.
I have the same issue, yeah.
And the people who are doing the research don't have our training, so they're comparing sham versus not.
Right.
And that makes no sense
Right.
because you
Right.
can take cutaneovisceral response, reflex response, and therefore any stimulus on the body has an effect somewhere at an organ that's innervated by that dermatome. So how do you say sham versus not, right? It's just the wrong way of understanding the medicine. Instead, we should be looking at mechanisms and how to apply those to difficult cases.
Yeah.
So there is research. It's improving, but we're not there yet. And that's the problem.
So much to do. So what would you tell someone listening or watching today who's curious about Chinese medicine?
Despite all the negative that we just said,
Yeah.
Chinese medicine hasn't disappeared for thousands of years, and it's not going anywhere because it works, right? So that's the first thing I would say. And if you're interested in Chinese medicine, find a practitioner and then have a conversation with them, because it has to be the practitioner for you, right? If they don't seem like they're connecting with you or understanding you, or you're looking for something specific during your healthcare journey, like if you come to me for wellness and relaxation, I'm the wrong person. There's nothing relaxing about what I do.
Yeah.
But if you're coming to get out of pain, I'm the right person for you, providing it's the pain I treat.
Yeah.
Right? You have to have those conversations, because an acupuncturist doesn't mean anything. It means they're licensed and trained.
Right. Beyond that.
Full stop,
Yeah.
right? That's it. You have to find the person that understands what you're dealing with and where you are on that journey.
Such helpful advice. I'm assuming the books are available everywhere books are sold.
Everywhere books
Are you
are
on
sold.
all social media?
I am on, unfortunately, all social media.
Okay, what's your handle?
So it's J Barber LAC.
Okay.
So LAC stands for Licensed Acupuncturist.
Okay.
I'm more active on others, but yeah, I detest social media, but I understand
Necessary
its usefulness.
evil. It's
yeah,
one of the necessary
because
evils of our time.
I will doom scroll just like the things that I tell
All of
patients
us
not to
do.
do. It's
All of
10
us do.
p.m. and I'm like, oh no,
Why am I here?
yeah.
All right. Final question. What makes you whole?
So I'm going to go back to when we talked about the emperor and stillness. I am human. There are many things that are not whole about me, right? Because I live in New York City. This place is crazy, right? I'm born in New York. But I try as much as I can to keep a still, calm mind and a joyous heart. And I believe, despite all the adversities I've dealt with and continually deal with, those insurance companies, oh my God, I can go back to that center and everything's okay. Even when I'm like, the world might be ending today, everything's going to be okay. So I think that's what makes me whole, is that I take these principles to heart, and I take that clear principle of keeping a very still, joyous heart, but not overly joyous, just calm. And I think that's what makes me whole, because everything else, the cheeseburger, all the examples are really me that I've talked about here.
Yeah.
So,
Got it. Okay.
I think that's what makes me whole.
Are there practices that you do on a repetitive basis to keep a calm mind and a joyous heart?
They change seasonally and depending on what I'm dealing with. So
Fair.
I've always been an avid meditator, but meditation for me borders into cultivation and Chinese practices. But ultimately, they're just stillness practices. Sometimes I do movement-based therapies. We call Dalian, Qigong, Tai Chi, depending. I'm a former martial artist because
Okay.
I've broken too much and I'm done. But it doesn't leave you. So I have a lot of practices like that. But ultimately, I like to sit alone and just enjoy nature. That by itself is beautiful because the world is beautiful if you see it that way.
I love it. Well, if you've ever been curious about Chinese medicine and you'd like to learn more, definitely check out Dr. Jordan's book. And for all of you watching, remember, we go deep on Chinese medicine, acupuncture, herbs, all of it in my private community, which is The Circle. Please feel free to join us there. It's at wholeplus.co/circle. We post new episodes every week. I want to see Chinese medicine become the standard of care in the medical model, meaning integrated into the medical model. Hopefully we can see that with the next generation who is so curious about this method of medicine. And it is not woo, right? It is very practical, very science-oriented, very nature-oriented. And, it has really been such an important part of my personal healing journey, which is a part of why I think I'm just so passionate about it. So thank you for joining us today. And thank you all for watching and listening.
Thank you.
Before you go, remember, healing doesn't happen all at once. It happens in moments. If today's episode gave you one of those moments, subscribe and keep learning with me. The next video is right here, and it picks up right where this one left off.